Can you name the health condition affecting tens of millions of Americans that's often misdiagnosed and dismissed as stress, depression, PMS, or overeating? If you said thyroid disease, you're right. Yet, it rarely gets the attention it deserves. January is Thyroid Awareness Month, a time to shine a spotlight on an almost silent epidemic. Thyroid disease affects all aspects of our health, yet it remains underdiagnosed and misunderstood. Thyroid conditions can be debilitating, and with so many people struggling with the challenges of diagnosis and treatment, one thing is clear: we need much more thyroid awareness. In fact, 1 month isn't nearly long enough. Let's look at why we need thyroid awareness all year long. Thyroid symptoms are often vague and mimic other conditions like aging, depression, or menopause. As a result, many people with thyroid symptoms are never tested, end up being misdiagnosed, or they're being treated for the wrong conditions. There's no routine screening for thyroid disease. And many doctors use only the thyroid-stimulating hormone TSH test to diagnose thyroid conditions. Without routine screening or more complete thyroid panels, millions remain undiagnosed. A complete thyroid panel should include the TSH test, plus free thyroxine, free T4, and free T3, free triiodothyronine. It should also include thyroid peroxidase antibodies, or TPOAB, to identify autoimmune Hashimoto's thyroiditis, the most common cause of an underactive thyroid in the U.S. Thyroid disease is also stigmatized, because it affects women 8 to 10 times more often than men. Some doctors view thyroid disease as a condition that middle-aged women use as an excuse for being overweight, tired, or having a low sex drive. As a result, some women are reluctant or embarrassed to even raise the issue with doctors. Even with treatment, unresolved symptoms are very common. Why? Many healthcare providers treat solely to manage TSH test results. Others prescribe only a T4 medication like levothyroxine, and refuse to treat with T3 or natural desiccated thyroid. This leaves many patients undermedicated and undertreated. Malabsorption of thyroid medication is also a problem. If you have digestive issues or conditions that affect absorption, like Crohn's disease, gastrointestinal reflux disease, GERD, an ulcer, or irritable bowel disease, IBD, you may not effectively absorb medication. Or you may be mistakenly taking medication along with food, coffee, iron, or calcium supplements. If you have malabsorption, you may need to change your dosing schedule. In some cases, you'll need a higher than normal dose of medication. Or, you may need to switch to a liquid or gel cap form of levothyroxine like Tirosint for better absorption. If you have undiagnosed or poorly treated thyroid disease, you face a number of risks, including an increased risk of heart disease and type 2 diabetes, obesity, infertility, recurrent miscarriage, premature delivery, liver disease, depression, and neurological and memory problems. Some thyroid problems, when untreated, can increase the risk of developing thyroid cancer. Eventually, long-term untreated hypothyroidism can in some cases lead to a condition known as myxedema, coma, and even death. Awareness starts with you. Know your thyroid risk factors, like a family history of thyroid or autoimmune disease. A personal history of autoimmune disease, especially type 1 diabetes, celiac disease, rheumatoid arthritis, Lyme disease, or Sjogren's syndrome. Pregnancy or recent childbirth is another risk factor. Also, pay attention if you've had COVID-19. You'll want to watch for iodine deficiency or excess. And your risk goes up if you're a current or former cigarette smoker. Finally, you're at higher risk if you've been exposed to radiation from a nuclear accident, for example, Chernobyl or Fukushima. Whether you're diagnosed or undiagnosed, if you have any symptoms associated with thyroid conditions, always insist on a complete thyroid panel, TSH, free T4, free T3, and TPOAB, not just a TSH test. You can also find a thyroid-savvy healthcare provider so that you are getting the best possible thyroid diagnosis and treatment. Experienced practitioners understand how to diagnose thyroid conditions properly. You also want a provider who knows you'll have the best possible quality of life, not when your thyroid levels are just normal. but when your treatment is optimal. Finally, whether it's Thyroid Awareness Month in January, or any other day of the year, please do your part to help spread thyroid awareness with friends and family. And, if you have a thyroid condition, it's especially important to let family members know because they are at a higher risk of thyroid problems themselves. This video has been brought to you by Paloma Health, the nation's leading medical practice dedicated to hypothyroidism care. Learn more at www.palomahealth.com.